Fab. Well, thank you very much for joining us today. Like you already will be aware, we're going to be taking a look at the Jenx Supine Stander today. So first of all, just to introduce myself, I'm Richard. I'm the National Clinical Training Manager for Giraffe and Jenx. A picture of me looking about 12 there. But we also have Paul Everett with us today, who is the Jenx Sales Manager, and he'll be going through the product demonstration for us later on. And we also have Chris as well, our marketing executive, that's been contacting you and will contact you in the future. So first of all, hello, we're Giraffe. If you are new to us and don't know who we are, we're the proud distributors of Jenx, Riften and the Kid by Tata. As you probably can guess, we've got the Jenx sales manager with us, and Jenx and Giraffe are one company, but Giraffe is the UK distributors for those products that I've just mentioned. So what we're going to look at today, first of all, I'm going to just take up about 10 minutes of your time just to have a brief refresher about why it's so important that we get people standing. Just going to mention as well that I'm going to go through a little bit of the research, but we're not going to delve too far into it because we don't have too much time for that today. However, we will send you a copy of the reference list as well, so you've got some bedtime reading to do there if you do wish. And then after that, I'll pass over to Paul, who will do a product demonstration of the Supine 3. And after that, we'll have a question and answer session as well. So please feel free to ask as many questions as you want. Just to let you know, there is a chat function as well. So you'll see on Teams that there is a little conversation box. Please feel free to type any questions into there. And whilst Paul's doing the demonstration, I'll try my best to answer those. And then at the end, we'll have some allocated time to go through that as well. Okie dokie. So in terms of why we need to stand people, especially those with disabilities, there's multiple benefits that we're just going to take a look at. So in terms of postural management, there's a lot of benefits around our muscular system and improving our skeletal system, as well as internal organs, which we'll take a quick look at. But also in terms of that psychological benefit of being eye to eye with someone or on the same level as your peers is really important for engagement and interaction and learning about spatial awareness and gaining more body awareness as well, and that proprioceptive feedback from being in a standing position. So just to highlight some of the main kind of clinical benefits of standing. Improved bone mineral density. So we'll take a look in a moment at some of the evidence that kind of proves that standing has a positive effect on bone mineral density. But also, if we look at the formation of a hip joint as well. So when we're born, we don't naturally have that acetabulum groove, and it's something that we have to develop over time of being in an upright position, bearing weight through our skeleton and moving. And it's that occurrence and that pressure that over time forms that hip joint. Also, in terms of reducing the risk of tissue adaptation and developing contractures. So by being in an upright, fully extended position, it allows our hamstrings to have a nice stretch and go through its full range of motion. And also there's evidence to show that standing can also help to reduce spasticity, especially in children with cerebral palsy. So the information that we've looked at today, it's all based around a systematic review done by Ginny Paleg back in 2013, and she looked at the dosing times basically around paediatrics of how long a child needs to stand to gain a certain benefit. So as you can see there, she took a look at 687 studies, and of those studies, there was 30 that met the inclusion criteria to warrant the evidence to be credible. Kind of in summary, because we don't have too much time to go through it now, but some of the highlights out of that systematic review was that a standing program over 5 days positively affected bone mineral density. and you can see kind of the timings there on the slides. Also, we'll take a brief look at standing in abduction and what the evidence says there as well. But in terms of hip stability and formation, there's some evidence to suggest that standing in abduction is beneficial for that. Also, in terms of being able to move through our full range of motions in our ankles, knees, and hips, and also in terms of reducing spasticity. And I just wanted to pull this quote out as well, just because I feel like it really encapsulates the importance of postural management. So especially for those children that can't ambulate or ambulate less than 2 hours a day, it's really important to have a broad cross-section of different positions that we adopt. And a lot of secondary complications are directly linked to long periods of time in a seated or a supine position. So this slide, I like this slide because I like the imagery, and I think it really depicts what can possibly happen really well. So on the left-hand side of the screen here, we have a normal hip joint that's been kind of formed over a child's as their child is growing. And as you can see, the acetabulum, or the hip groove, the socket there, has been formed really nicely. And those white lines that are attaching to the femur, that's representing the ligaments and the tendons. So as you can see, as we move to the right here, we've got a box that depicts subluxation, and the other two that look at dislocation. And as you can see, if we look at the acetabulum groove there, they're not as formed as well, which means that child's more likely to suffer from subluxation or dislocation. So that's probably from a child that may not have been able to stand from a young age, and after the ages of around 6 or 7, our bones become less malleable and more fixed, and those problems can therefore kind of you wouldn't be able to improve a hip joint. So here I've just pulled out some of the findings again from that systematic review, just to point out a couple here. So the top one there with Gibson, that was around looking at hamstring length in a standing position, and the positive outcomes that were found there. The second one down is the study that was done in abduction as well, which I do have access to that study as well. If you are interested, do feel free to get in contact and I can send that through to you. But that showed that children that did stand in abduction formed their hip joints better, but also it reduced spasticity. They found the children that were engaging in gait training, they weren't scissoring as much, in fact at all, and the control group still tended to scissor. And then the third one down, just wanted to point that one out around contractures as well. So they found in that study that it was only the control group that started to develop contractures as well, and no one in the actual treatment group formed contractures. And again here, just pulling out a few more benefits. So the reduction of dizziness and issues around breathing difficulties and foot swelling. 40 minutes of standing 3 to 4 times a week has shown that it can reduce those problems. And the second one that I've got here, I just found really interesting. It's to do with children with muscle dystrophy and spina bifida and their spinal cord injuries. And it shows that if you are able to stand that child with beyond neutral hip extension, then it allowed for tightness in the hip flexors to be reduced. And if you are interested, in that study, it has some imagery of how they actually achieved that as well. So, and again, that's just from a study around the reduction of spasticity in children with cerebral palsy as well. But like I mentioned, I have all these the reference list, so if you want to look a bit further into those, Chris can send those across to you. So I won't read out the findings again because we've gone through that, and that is pretty much what we've just spoke about. So what I will do now is I'll pass on to to Paul, who's now going to look at the supine stander, and we'll go through a full demonstration of that. Now I'll stop this PowerPoint presentation, but if you are able to find Paul on your contact list, so if you click on the participants list, you should have a list of everybody. And if you find Paul Everett, and you'll see that there are 3 dots next to his name. So if you click those 3 dots, and there'll be an option to pin him. So if you click that button, it will make Paul very big on your screen, so you'll have a much better view of the presentation. So without further ado, I will pass on to you, Paul.
So thank you, Richard, there for that introduction to standing presentation. As Richard introduced me earlier, I'm Paul Everett. I'm the sales manager for Jenx, and I'm very fortunate to, under normal circumstances, spend a lot of my time with clinicians from around the world, educating them on the benefits of Jenx products, and also learning from them as to what they want future products to do. So today we're going to look obviously at the supine standing range, which is a small pocket of the standards that we offer. And we actually offer the supine stander in 3 different sizes. The reason we've chosen size 3 to go through for the presentation is that obviously it's a larger unit, so it's just a little bit easier to see on the webcam. But we do have the size 1 and the size 2 in the room as well, just for visual representation. They all share a number of common themes, so even though we're talking about the size 3, a number of the common issues can be found on the size 1 and 2. So to start off with, I'm going to talk about how the products are constructed, because actually that's a really important part of understanding the clinical benefits of standing. So you'll see that we actually have quite a wide board here. And we're talking about standing people only in the supine application, so we don't need to worry about the ability to turn it into a prone stander or an upright stander. So we can really focus on what that individual child or young adult needs when they're going to stand in that supine position. And what we found that particularly in the UK is that if we have children who are 5 or 6 years onwards, are standing in supine, particularly in the school environment, then they're traditionally going to be hoisted in and out of the product. So what we wanted to do was to make that a safe and secure process for aiding that child in and out of the product and giving everybody involved in that transfer confidence to come in and out of the product. So this nice wide landing board that we have, when we set the board down to that horizontal, we actually have a really big landing area for that sling to come onto, so we don't have to worry about being absolutely precise when we hoist somebody in, and we can tweak and tailor the product as we build it and configure it around that child. Now, just to say at the moment here, we haven't got any of the support laterals on, so we're just looking at the open board just for this bit of the presentation. So like I say, designed for that real simplistic ease of transfer in and out of the product, and as we put the support pads in, we'll see how they adjust laterally and how we can build this product around the child. Now, the nice thing about that is that obviously thinking to maybe a school application where you maybe want to to share a standing frame between a number of different users, it's very quick and easy to make those adjustments. And I'm not quite so sure how clear it's coming through on the screen, but the boards are actually numbered, so it's very easy to work out where to align certain support pads to. So the baseboard itself, everything that you see on here that's green is made of a polyurethane material. So polyurethane is a self-skinning foam, so it has the same properties of foam as in that there is some compression value to it. So from a comfort point of view, it's not a solid surface. But what it has is this skin that becomes completely impervious to any body fluids. So as Richard touched on in his presentation, one of the clinical outcomes that we're aiming for with putting somebody into a standing frame is aiding their postural movement, their circulation, their postural drainage. And very often what you find is that with individuals who spent a long period or an extended period of time sitting down, when we get them up into a standing frame and gravity does what we want it to, we tend to find that we get that sudden movement of all those internal toxins that the body's wanting to get rid of, so the urine and the feces. And we sometimes find that for an individual who maybe hasn't stood for a little while, we get quite an outflow of those body fluids, and sometimes that can end up soiling the product. So we wanted to make it so that it's really nice and easy to keep clean. And in the modern world we find ourselves in with the pandemic, it's also a very hygienic surface from a cross-infection control point of view. So if you're needing to share the product in a school, as I was saying, between multiple users, it's very easy to wipe that clean and it dries in seconds, and you know that you're doing your bit to contribute towards minimising cross-infection risk. Going down to the base, we've got a nice solid metal base that the product's built on, and it's on 4 quite sizable casters, so it's relatively easy to move around. We certainly don't advocate using the product as a mobility device, but certainly within the classroom and when you're transferring it maybe from one class to another without a child in it, it's not too difficult to push at all. Now, one of the areas that we spent a lot of time doing some research on is the electrics and the mechanics of how the product moves up and down from vertical to horizontal. And a lot of this research was based around feedback that we had from a number of therapists, particularly in the UK, who were concerned of what happens if the classroom staff have forgotten to charge the battery and the child's in an upright position and we come to lower them and then we suddenly find that we can't lower down the boards. Is there a safety override? And a lot of that train of thought came from manual hoists that have the battery operated arm on them, which sometimes do have a mechanical release mechanism. So we were working with the manufacturer of the actuator to see if we could have a similar kind of safety mechanism on the supine standers. But because of the weight capacity and the way that these products work, neither ourselves nor the manufacturer of those actuators were happy or confident with the outcome of utilising those actuators. That's why we haven't put that kind of mechanism into the board. So what we've done to try and forward think and prevent those instances from happening is that we've now had a custom built handset that actually has a power display built into it. And again, it's not one of those things that's going to come through very easily over the TV screen, but a bit like you'd have on your mobile telephone, there's a battery indicator that shows when the battery's nearly empty and shows when it's fully charged. So we appreciate that in a busy classroom, there might not always be somebody who takes ownership of making sure that the standing frame's charged. So this way, before any classroom staff, before any teachers, before any parents or carers put the child into the product, they can quickly check the status of the battery and check that it's actually charged enough to be able to use it on that standing experience. There's also a programmed safety cutout in the main control module, which means that if there isn't enough power in the battery for it to do a complete cycle of coming upright and going back down to horizontal, that it will actually cut out and you won't be able to do it. So even if somebody completely overlooked the battery indicators, the supine stander is actually intelligent enough to not be able to come up into that upright position and then get stuck. If somebody does manage to find a way to force it around that, there is also an audible alarm that sounds. So again, there's a reinforcement there. And if for any reason the product does come up and then there is an issue, there's also the ability to plug directly into the mains and bypass the battery. So that will allow you to lower the product. So we've done pretty much as we can to ensure that there's a number of safety mechanisms there to ensure that, particularly with the taller, heavier, bigger users, that you're going to be able to get that product upright and back down safely. So like I say, that's just one of the things we've done from listening to feedback in the marketplace. So obviously, like I said, here we have the board as is whole. One of the things we recently introduced to Supine 3 is the ability to remove some sections. So this has always been available on the size 1 and 2, but like I say, we've recently introduced it to the size 3, where by loosening off some bolts on the back, we can actually remove the top 2 sections. So what looked like quite a tall, daunting standing frame can now be dropped down to a much smaller unit, which means that we can get some really good longevity from the product. We can get children from around about 8 years of age in here, and this will grow through right until they're in their adulthood. So we wanted to make sure that we're providing products with plenty of growth opportunity, and that again, you can utilise with a number of different children of different stature. And then as the individual from here would grow, we're able to reintroduce these boards and then lock them into place. The nice thing about being able to remove these sections as well is that if you wanted to use something like a multi-grip head support to could give some more appropriate head control, then we can make sure that the child's shoulders come to the top of that board and then fit the head support so it stands proud above there. And in terms of overall growth on the product, if I actually just illustrate by popping this head supporter up here, you can actually see that that is quite a tall unit that we've now got. We can accommodate somebody who's over 6 foot tall by utilising that head support on top. And like I say, we can get that to go down to the size of an 8-year-old. So an awful lot of growth potential in one product there. So coming down to the foot plates, we have individual foot plates because we recognise that as individuals get taller and older, that they may have some leg length discrepancy forming. There may be the need to accommodate more knee flexion in one leg than another. So we've individualised the foot plates there, and they can both be adjusted up and down to accommodate that leg length discrepancy without the need to introduce any sandal razor blocks. And they're also angle adjustable, so we can adjust them for plantar and dorsiflexion, particularly in the plantar grade, like I say, if we have got that knee flexion and we want to be able to accommodate that foot accordingly. Onto the foot plate area, we can mount our sandals so we can ensure that that foot is securely fixed down to the foot plate and that we're getting good weight transfer and we're actually not allowing that leg to lift up with the movement of the leg. So it means we're getting good weight distribution down through the feet. And if we loosen off the wing knob under the sandal, hopefully we'll be able to see that we can actually move that sandal, create some abduction in the standing position, create some rotation, and get that sandal exactly where we want it to be. And as with all Jenx products, the sandals come in different sizes, so we're able to accommodate different size feet. So we know that for some children, even on the smaller settings, they tend to wear oversized footwear because of their orthotics. So we can ensure that we can accommodate that. What I'm going to do now is bring the board down to a horizontal, just because it makes it a little easier for me to put the support components on. And you'll see that it's a nice gradual movement. Now, one of the things that we certainly advocate when you're taking somebody, putting somebody on a supine board and moving them for the range of motion is that you don't do what I'm doing now, which is just do it all in one fluid motion. We'd actually always suggest doing it in stages and seeing where the individual felt comfortable with. For anybody who's not had the opportunity to stand in a supine standing frame, I'd really urge you to do so. It's a bit like that experience you can have when you go into a hoist, and actually it's quite a daunting experience, and very often what we find is that people who are on here, when we're coming back down from the upright position, feel like their head's going to touch the ground because it's quite disorientating. So again, for the client group that we're working with, it's quite nice to recognise that they may be a little apprehensive during that movement, so to do it in stages. And again, that just helps with their body regulate circulation, blood pressure. So don't suddenly come from lying down to upright, do it as the individual feels comfortable. And the great thing about the handset is that you can move anywhere around the product and still activate that control. So you can make sure that if you need to give reassurance, you're closer to the individual in the eye contact, or if you're trying to make some adjustments to a leg position as you come up, you can stand wherever you want to and your handset's there where you need it to be. So we're going to start off at the bottom and work our way up and put the support pads in place. So just imagine now that we've hoisted somebody onto here, we're doing our assessment for the first time. We've never put them in the product before, but we don't need to keep taking them in and out of their wheelchair to take measurements. We can hoist them onto here, and providing we've still got them safely held by the hoist sling, we can start to build the assembly of the support structures around them. So we're going to start off by putting in one of our knee support components. Now what I'm going to do just for a minute for the ease of showing you on camera is just build up on the one side, just so that we don't interfere with the camera view that we're getting. So we've got these slots in the board and we've got these feet that come out from the bottom of the support pad. So what we're going to do is just simply slot this support pad in where we want it to be. Should have put some brakes on. There's a schoolboy error, always put the brakes on before you start making adjustments. So we pop our support pad in where we need it to be and then clamp it into place underneath. So the nice thing about this is I haven't had to get any tools out to do this. So again, if you are wanting to share a product in a school environment between different children, it's actually relatively easy to do so. And we can actually get some minor lateral adjustments of that pad as well, so it doesn't have to sit directly in the centre of the board. We can tweak that to where we need it to be for the individual. Now, this pad that we use in here is our knee flexion option. So we recognise that children who are standing may have that degree of knee flexion. So what we don't have as a manufacturer is knee cuffs that come around the front. We're a firm advocate of these knee cuffs, and these were actually developed in conjunction with the physiotherapy team down in Birmingham many moons ago when we developed the first standing frame, supine standing frame. And what they were looking for was, instead of just having a knee cup that came around the knee but didn't really control what the leg was doing, they wanted something that would grip around the leg so we could actually influence internal and external rotation. So that's particularly pertinent for those children who maybe have that high tone internal rotation, who are at risk of hip subluxation and dislocation. So how this strap works is, on the outside I have these straps that I loosen off. So if I loosen those, I'm going to try and turn this now so you can see this. I have this strap here that I can pull, but this isn't one solid strap, it actually has two sections to it. It has the black strap and the grey strap. So what happens is, if I wrap this around the child's knee, and this is one of our X straps, so it's designed to brace either side of the patella, so we're not putting any pressure directly through the patella. If I pull those two straps together, then what I'm doing is I'm pulling that knee into as extended a position as is comfortable and desirable for the child using the product. But then if I then split this strap on the outside by releasing the Velcro, it's very hard again for you to see this on the camera, but hopefully there will be some be able to see it. If I pull on the black strap, I'm actually getting internal rotation on that knee cuff. And if I put on the grey strap, I'm creating external rotation. So again, like I say, it's difficult to show over camera, and it's it's one of those things that's considerably easier when there's actually a knee in here and it's bulking out the strap. But it's very effective if you've got that strap tightly around the leg, so it's still comfortable. You can actually really influence that leg position. So whereas with a form knee cup that would come around the front, you can actually still twist your knee within that. Using that strap, you can get that really nice control of the leg position there, and like I say, correct that rotation. The straps do come in different sizes, so again, we recognise that children and young adults come with different shapes and sizes, so we're able to accommodate somebody who maybe is on a steroid treatment, so has quite a lot of water retention, quite a lot of body tissue, or those really high-tone kids who burn off 1 million calories an hour and have really skinny legs. So we can accommodate all ranges there. What we also have in this particular variant is our foam pad that sits in behind the knee. So this is really nice where you have knee flexion to accommodate. So again, rather than being a company who have a knee cup that comes round and just supports at the front and then potentially leaves a gap behind the knee, we actually want to give a nice soft contact surface to sit in behind that knee, that we can accommodate that flexion and actually not almost leave the knee suspended in midair. We can make sure that we support all the way up. And we actually have our spacer blocks that we can sit in behind here, and obviously that stack would be too big on its own, but if we take 3 off and put those in and then put our foam pad into place, you can see that now we're accommodating quite a significant amount of knee flexion, and we can build those pads up to the amount that accommodate that individual's needs. Now, we're often asked how much knee flexion we can accommodate. And that's really down to the clinician to understand what each individual person on their caseload can tolerate. As a manufacturer, we can make pretty much anything, but there comes a point where it becomes unrealistic to stand somebody. So I'd say that's really where you have to use your individual clinical judgment on each of the children and young adults that you're working with as to whether you can actually accommodate their knee flexion and whether they would then be able to tolerate a dosage of standing with that flexion. So I'm just going to pop these out of the way now, just so they're not being a distraction for what we're doing. So that whole knee structure works particularly nicely, I say, for being able to come around the leg, control rotation, and allow for a flex knee position if we need to accommodate that. Now, on the size 3, unfortunately we can't do this on the size 1 and 2, but to date we found we haven't really needed to. Where you're looking at somebody who potentially does have quite a lot of knee flexion and that wind sweeping posture, we also have the option to insert an abduction block. So we can pop this into place, and what this does is it comes up and sits between the legs. So if you think like a T-roll that you would put in between somebody's legs if they were lying in supine, we can achieve something very similar with the accessories that we have on the Supine 3 here. So we can bring them from that windswept position through to that midline, and then get our extension and then lock everything into place. So again, in terms of coming in and out on that hoistling, it's nice that this is a removable component, so it makes it a lot easier for that transfer in and out of the product. So we put this back into place, and then on these sides here where you see the wrap material, that allows us to use these foam pads, because obviously if you're windswept and you've got a tightening on one side and you're coming across, there's potential that you're going to be putting a lot of pressure through that lateral aspect of your knee. So we want to be able to provide that nice padded area that you can compress down onto and hopefully minimise the risk of any sores developing. So a lot of things there that we can do to control foot and leg and knee positioning. And now we'll move up to the pelvis. So again, we have our nice big blocks that we put into our pelvic position. And again, we can slide these in up to the point where they make contact with the individual. We can adjust, we can twist, we can get those fixed wherever we need them to be. And then again, we just tighten down on our ring knobs to fix in. Now, with this one, what I'm going to do is put the opposite side on, just to show you how our control strap works. But just quickly before I do that, it's worth pointing out that on a number of products that are available out in the market, they have these lateral pads or a form of lateral pad, and to that pad is stitched the strap that you're going to be putting around the body. Now, whilst there's nothing wrong with that, we wanted to be able to give more control, particularly at the pelvis, for controlling rotation and obliquity. So what we've done is something different with the way that our straps work. And again, if I just turn the standing frame so hopefully you can see. You can see how now I'm able to move this strap by loosening the external strap. So let me go ahead and just put the opposite side on. And lock that into place. And loosen up the external strap. So now when I put somebody into the standing frame, haven't got to worry about stretching out those tight hip flexors. I can lie them in. Gravity's really being on our side here. It's holding somebody against the board. We're getting their legs into a good position. And then we do our strap up, but at this point we're not having to worry about really correcting that rotation, because what we can now do is pull on that external strap, and you can see how that pulls down the main body of the strap. So what that's going to be doing is, if you've got that rotated posture, we're going to be able to pull down on the side that's rotating and correct that as much as is comfortable and feasible for the individual using the product. And we can do the same on the other side. So we can really get that good amount of hip flexion extension and control rotation. And what we can find as well is that if we've got somebody on here and they have been in their seating posture for a long time and we find they're very tight, we can actually do this to the point where they're starting to get a stretch, and then obviously stay with them, talk to them, but allow them to have a good few minutes to let gravity carry on working out, stretching everything out. Maybe we could be doing some therapy whilst that's happening, and then we can come back and make our final tweak to make sure that we're happy with the pelvic position that we've got. And then when we're satisfied, we just simply do up our safety straps at the front and tidy up our straps. So again, really good features there to be able to control that pelvic rotation, that hip flexion, and get a really solid position. Because obviously if our pelvis is out, then it's going to throw our trunk out and minimise the effect on the head control. So super key lock-in point of somebody's posture in the product is what we can achieve with their pelvis. Coming on up to trunk, we could potentially use another set of these in the trunk, but you can imagine your arm set, you're going to be doing your Wurzel Gummidge scarecrow. Apologies to people in the room who aren't young enough to remember Wurzel Gummidge. But what we actually have is our flexi laterals, and we use these on a lot of our products. And you've got to think of these as a big pair of hands. So if we lock these into place, again, exactly the same mechanism as we're using on our other products. And we lock those down, same derotation strap. But now what we're going to find is that we can actually flex this pad here. So we're going to come around and we're going to give that a nice big hug. So instead of just that lateral stability at the side of the ribcage, we're actually going to come around and really give some good control of that trunk. And again, because we can move those brackets up and down, we can offset the scoliosis if we need to. So we can get some really nice position in there. So again, if I put the opposing pad into place and lock that down, we can see that I do the strap up and we do up the buckle, and then we pull down. Again, this is always so much easier to demonstrate when there's an individual in here and their body mass is filling the void here. But you can see that we can get that control, and that's going to come around and really hold somebody's posture really nicely. So we've got somebody in here. Up top we can use obviously the head support that I showed you a minute ago. More frequently we use either the multi-grip head support, which is our head support with the fingers that allow you to sculpt and mould and get that head support positioned exactly where you want it to be. Or we can just put a head support pad on the board. So if you actually don't need that fine control, you just need some lateral barriers. You can actually see it on the supine one over here. It's just a nice pad that's located on the main board, and on the supine 2 you can see where we've got the multi-grip standing exposed. We can put those into place just so that we're giving that nice lateral control and getting that head into position. And then, as I say, let me just put the other kneecap into place so that we complete our configuration here. Move these off. We can then bring our whole unit into the upright position. So like I say, the mechanics itself don't allow this to be a sudden quick transfer. It's a nice gradual come to the upright position, but normally we suggest stopping, having a few seconds, allowing the individual to let their body adjust to their change in position, and then bring them back up again. But even if you were to be negligent of doing that, it's not going to be a sudden quick move forward. It's a very gradual process. And then we come on up. There is actually also an angle gauge which is located underneath. So if you were to be prescribing to a school or a parent a particular angle that the child could stand at, it's very easy for them to identify where that is by looking at the gauge. It means nobody's having to guess at what angle. So we know that for some individuals, we're not going to want them to come completely upright because that could be detrimental to their health. So it's quite easy to prescribe the dosage of standing and the angle of standing that you want that individual to achieve. And then when we've got them upright, obviously we want them to be able to do something. So we can then introduce our tray, which simply goes into the tray support bracket. And again, I've taken the brakes off as I've been moving it around. We can set the height of the tray wherever we want it to be. And again, a nice new feature on the size 3, but something we've always had on the size 1 and 2 is the option of either having a solid surface for activity. So if you were maybe doing some propping, if you were doing some drawing or playing with some toys, you've got a nice solid surface. Or we can remove the overlay and introduce a play bowl. So into here, if we're wanting to target in particular maybe some hands to midline activity with some slime or some sand or some dried pasta, we're able to do that and introduce that individual to the concept of bringing their hands to midline. And we can also put on elbow blocks onto the back of the tray. So if we have somebody who has a tendency to retract, obviously we've got a nice wide board here which is going to keep their shoulder girdle relatively stable, but maybe their elbows want to come and fall off the back of the tray. We have the opportunity there to put some elbow blocks into place. So really that's a head-to-toe overview of the Supine 3. Like I say, the size 1 and 2 do have some minor differences in terms of accessory range, but on the whole, you're going to get a very good overview of how all of the products work and the kind of design intentions that we put in to make them real world practical with the ease of cleaning and the ease of adjustability. So I'm going to hand back to Richard now, but if anybody has any questions, please let us know.
Thank you very much, Paul. I just wanted to point out as well, when you were talking about knee flexion as well, that we've got the ability to change the foot plates, the dorsal and plantar flexion as well. So obviously if someone is standing with a degree of knee flexion, then we might need to accommodate that with the feet. So we're able to do that with the Stander as well. But yes, thank you very much for attending, and we'll call it a day, I think.
Thank you very much, all.
Yeah, thanks, Paul. Feel free to contact us with any other questions as well.